we need to set out quantitative criteria for suspending the radiological equipment of service until they are repaired or until they are definitely taken out from service. Radiation Protection 162 was a very important publication set out by the European Commission in order to establish criteria of acceptability of all the class of radiological medical equipment. The publication date was 2012, so since then many years have passed and there is now the need for updating this publication because mainly of three reasons. One is that in that publication there were equipment which are no longer in use, at least in Europe, like screen film cassettes or cobalt therapy used for external beam radiotherapy. The second reason is that new class of equipment came into the market which were not present at those time in 2012. And the third reason is because in the existing criteria for acceptability, since many technological developments have been established for existing technology, needs to be updated. The consortium, which is led by ABIR and encompasses EFOMP, ESR, ENM, and ESTRO, will try to update RP 162 basically in three means. By doing a systematic review of the existing scientific literature, by revising the so-called gray literature, which means international standards published by international bodies like IAC or NEMA, and by taking a survey in EU countries to see how they were applying RP 162 in the past and which have been the new development since 2012 until now. With these three tools, we will try to update RP 162. This project is very important for the safety of use of medical radiological equipment because all the medical physicists throughout Europe need to perform quality control, but they need quantitative criteria to know when it is time to suspend the machine from clinical use, to ask for a repair or even for taking out the equipment from service. Because without quantitative criteria, the vast majority of medical physicists won't be able to do an objective assessment of these tasks. Obviously, we will take care of the fact that also in the European Union and in Europe more generally, there are low or middle income countries in comparison with high income countries. We will try to set these criteria in a way that they are affordable irrespective of the level of income of the countries. But below certain level, at least for the actual standards, a radiological equipment could not be considered viable, at least in the European Union. The challenges that we are going to face is that not always it will be possible to identify by searching the scientific literature or international standard or even with the survey that we are leading some criteria. In that case, the opinion of the experts which form the consortium and we are participating in this work will be necessary in order to provide some suspension level. This is the major challenge we see. The second challenge is that being a European Commission publication, notwithstanding this, it is not mandatory to follow this publication. But according to the experience we gathered from the survey, the majority of European countries are following the RP 162, so we are confident that also in the future they will be following the update of this publication.